We talked a lot about biomarkers, their potential relevance, and transforming how we treat a lot of patients. That's almost entirely been in the setting of advanced non-small cell lung cancer. One trial was presented that looked at checking a series of biomarkers in a different group of patients. It was a study called CUSTOM, looked at small cell and thymic carcinomas and things. And Mary, just tell us a bit about your thoughts about the trial. What does it mean? Where are we going with it?
Yeah, I mean, I think the investigators there are really to be applauded because they basically took patients who came in with non-small cell lung cancer, small cell lung cancer, and thymic malignancies, and when they hit the door, either they did a biopsy, did a panel of molecular markers, and then the goal was to try to assign these patients to customized clinical trials based on their molecular profile. And they tested around 600 patients, and they really had a very high likelihood of being able to obtain sufficient tissue and to be able to do at least one biomarker. It did seem that there were many patients who ran out of tissue with this sequential testing approach. So their approach was, test for EGFR if that's negative, then move on to KRAS if that's negative, then move on to ALK, some sort of sequence like that. So I think they did run into some problems with tissue overall. It was a great effort. The downside was that a very small number of those patients actually ended up getting onto a clinical trial. So that was a little bit disappointing. But I think the idea is great, is really do this testing up front so that you have information quickly where you can make decisions to refer patients to clinical trials or treat them with appropriate therapy. I think it's a great concept. I think the problem is, number one, I think you've brought this up, Nate, that it can't be just one institution. So this really needs to be a nationwide or an international cooperation, but the concept is great. And some of our cooperative groups are trying to design trials based on that.
Especially for uncommon tumors like thymic carcinomas, where we need to have multi-institutional efforts. And even small cell is now becoming so much less common that it's hard to do trials. And how are we going to ever have insights if we aren't doing this kind of interrogation and looking on a more multi-institutional basis?